Well, let's return now to our special health feature this morning, and we're talking menopause, and we just got the basics from Dr. Nicole Jaff a few minutes ago, and let's continue that discussion now with endocrinologist Dr. Sundeep Ruder. He deals with all things hormonal. Dr. Ruder, a very good morning, and thanks so much for your time. I know that you're a very, very busy man, so let's get straight to it. When we spoke to Dr. Jaff, she gave us the basics of what's happening in your body, what the symptoms might be. You deal a lot with hormones, so tell us what's happening hormonally in our bodies when we go into menopause or perimenopause, the run-up to it.
Yeah, so Dr. Jeff would have explained that firstly we shouldn't look at menopause as a disease, rather a change in biology, perhaps a new season of life. Of course, it does come with a lot of symptoms, especially in modern times with background, bad lifestyles, etc. The risk of having symptoms is higher these days, it appears. So menopause, the word meno means monthly and pause means cessation or stoppage of. So it's a cessation of your monthly cycles. And it's associated with many hormonal changes, mainly in women. Initially a fluctuation of the main female hormone estrogen, and eventually that estrogen level tapers off and drops off. So the ovaries no longer produce estrogen. And what happens with that are many changes around the body at the brain level, even cardiovascular, may affect weight as well, cognition, sleep. So what patients experience through menopause when they do have symptoms are what we call these vasomotor symptoms, hot flashes, night sweats. They may not sleep very well. There may be cognitive changes, they may get mood symptoms as well, and then sort of the genitourinary changes, sort of vaginal dryness, they may experience some urinary symptoms as well. Those are the more common ones, and then you may get others as well, affecting skin and hair, etc. So if those symptoms are very prevalent in patients, it can affect daily functioning and quality of life. And some of these symptoms may have bearing on future complications like cardiac and dementia. So it's important to do a very individualized assessment of women during this stage of life and treat appropriately, I would say.
So what are the contributing factors? I mean, what leads to this decline in certain hormones, the upsurge in others? How do we explain it simply?
Well, it's a natural progression, like I said. It's part of nature's law. I don't think we can explain why it happens in humans. I mean, some of the other mammalian species tend to reproduce later in life, so they have a very short post-reproductive lifespan. But humans tend to have menopause at an earlier age compared to some other mammalian species like whales, etc. So around 50 plus or minus 5 years, the ovaries shut down. And it signals the end of reproductive life. Now, why that happens in nature, I can't answer that question. But like I said, it shouldn't be looked at as a disease, rather perhaps a time. I mean, generally, if women have reproduced, then at that age, their children would usually be independent by that age. You'd expect around 18, 16 years of age if you've had them earlier. So I don't know. I mean, philosophically speaking, it may be an opportunity to reflect on different aspects of life rather than just the biological, you know. I can't say that that's the reason it happens, but it happens. It's not something wrong with the system. It's something wrong when it happens too early.
Yeah.
So there are diseases like premature ovarian failure or due to surgery or cancer chemotherapy that women can go into menopause early, and then it can have an effect on quality of life. The other aspect, Yuvika, is that we are living longer these days. So going into menopause, even at the normal age of around 50 plus or minus 5 years, can have a bearing on the quality of life and other diseases later. So this is where we think about treatment and how it affects quality. So that, look, I mean, it's not just about treating numbers and parameters. It's about allowing women to not feel physically debilitated by the symptoms so they can fulfill their work and purpose in life. That's important.
So how early are you able to detect whether a woman is moving into menopause? Is it a matter of a simple blood test to check on estrogen levels? Can we counter it? Can we put in, take supplements to maybe counter it or delay it in any way?
So if you're having your regular menstrual cycle, then there's no signs that you're in perimenopause or menopause. Usually it will be signaled by irregularity of cycle. So firstly, to be in that age category where it's expected, number one. Number two, there may be cycle irregularity. So you may find the cycle changes in its consistency, regularity. You may skip a few cycles, and in between those irregular cycles, there may be a few symptoms like hot flashes, night sweats, a little bit of change in mood. And we can test at those stages, but if you're still in perimenopause, the ovaries may kick in again and you may have a few irregular cycles. So generally we say with menopause is absence of a cycle for about a year, absolutely, with consistency of those symptoms of hot flashes, night sweat. And once you're there, you can easily test for it. We do a blood test called the FSH, which would be usually very sky high in menopause. And the estrogen level will be very low or undetectable in menopause.
So, Doc, we were talking about misconceptions earlier with Dr. Jeff as well. And, you know, a common feeling that you get from women who are in the stage is that they have stopped being a woman. You know, that doesn't seem right to me. And like you say, it's just sort of a season in your life and it's preparing you for other things. So just reflect on that for us, just your thoughts.
Yeah, I think some of the issue is expectation. I think the discussion with younger women on the education of natural changes of life is not something that's commonly done. So if you know what to expect biologically, sometimes it's about planning our lives around nature's laws as well. I mean, we shouldn't try and fight nature. Disease happens when we go against nature's law, you know. So I think if we have that program instilled at a very young age, that this is the natural cycle, I can do it healthily. I think education to young women in terms of healthy lifestyles is critical. Eating right, sleeping right, managing stress, don't smoke, moderate alcohol, I would say very little alcohol in the long term. You know, these kinds of things, if they're done very well, the transition to menopause is more likely to be easier. But then also to inculcate a sense of education around purpose of life. You know, I think we tend to get stuck with our obligations, and obligations must be done very well. We may have obligation to partner, to children, to family. Those are all the things that we need to do, but they are not the things that define us, because I often see in practice at this stage of life, there's a big sort of paradigm shift in how we think. Now, what is the purpose of my life? And all the things I put my value in, those crutches have been removed. Body's changing, the children have left home, what do I do? So it's important to have a sense of an ideal beforehand so that you can focus on that afterwards as well. So you maintain the body, it's going to go through its season through a healthy lifestyle. Exercise is very important to maintain muscle mass. We've got to screen for bone issues and stuff that come later. Cardiovascular diseases are common after menopause in today's times. But that's not the goal. The goal is to maintain the body to fulfill purpose. And I think that's a more holistic way of looking at it in the long term. So expectation is a big issue in it. That I think if we educated about it, then the expectation is reasonable.
And be prepared. Thanks so much, endocrinologist Dr. Sundeep Ruder there, just explaining hormonally what is happening, and it's just a seasonal part of your life. Well, we'll continue our discussions in just a little bit. We'll try and find out about alternative therapies, homeopathic therapies for menopause, if that's the direction you want to go. That's on the way. But we also have your sport coming up.